I'm doing AP hip. The IR size is going to be a 10 by 12. It's portrait and it's going to be lengthwise. You are going to use a grid for the type of anatomy that we're looking at. SID is 40 inches. You want the patient supine with the lower limbs internally rotated 15 to 25 degrees from the hip. If you suspect a fracture, you are not to attempt this positioning. The centering is going to be perpendicular to the femoral neck. The CR enters about 2.5 inches distal to the midpoint of the ASIS and the pubic symphysis. So we have the pubic symphysis here. The ASIS is about around this area. You're going to center the IR to the central ray. For breathing instructions, you're just going to have them suspend just to make sure they're not moving. The collimation, you want the collimation superior to the ASIS. We have the ASIS here, superior would be probably about right here. And you want the lateral skin margins here and here. And then you want it inferior to the proximal third of the femur, which would probably be around here. So for the collimation light field, you'll probably have it end here and start around this area. Here I have my right marker. Technical factors. KVP is going to be 85, and the mass on a CR it's 20, on a DR it is 10. The structures shown, you want the head, the neck, the trochanters, and the proximal 1/3 of the body of the femur. You want the hip joint and the greater trochanter. Can't really see here, but you want that in profile. The greater trochanter should be in profile, signifying adequate internal rotation of the limb. So for that to be able to be seen, basically lets you know that the limbs have been internally rotated to the correct degree. You want the entire long axis of the femoral neck to be running parallel to the long axis of the image, and then the regions of the ilium and the pubic bones adjoining the pubic symphysis.